I come to work every day knowing that with the proper guidance and support and compassionate approach, people can change for the better. The Elton John AIDS Foundation has helped us to be able to provide this support to the most marginalized individuals in our community. We operate a homeless day center and a syringe service program. The individuals that we work with, they're experiencing homelessness and often are particularly at risk because of the high usage of injection drugs. And amongst that population, we'd say 4 out of the 10 are infected with HIV. They just don't know their status yet. I'm myself a person with lived experience. At the age of 13, both my parents were arrested, incarcerated for 5 years, and then deported. I fell into my own addiction to antidepressants, and I made a lot of mistakes that kind of limited my career options. But we're here now, and with the staff of 75% of individuals who have been formerly unhoused, struggling with substance use, I see a lot of my own peers that I grew up with out on the street here.
When they first opened, I wouldn't come in at all, and then I started coming in to eat, and then I started coming in on a regular basis to charge my phone and whatnot, and then I just started coming in just to come in. They make sure I take my medicine on a regular basis. That includes my HIV meds.
Here on site, we offer rapid testing for HIV, Hep C, and syphilis, and we have a mobile medical unit that goes all throughout the county.
Knowing your status is a very important thing, not only for your protection, but for everybody else. And like we like to tell our clients too, we aren't with you 24/7, we aren't with your partners 24/7, so we don't know exactly what encounters you're having. So it's always important to get tested. Once they're completed with testing, if we have any newly diagnosed clients, we get them enrolled in medications, we get them enrolled in housing, anything that they would need to assist them to make it through this new life-changing decision. If we have anybody who has substance abuse, I ask them, like, do they exchange their needles or do they constantly reuse the same one? I lead them to Corazón and let them know that there are exchanges to keep them a lot healthier and safer.
So this gives people an opportunity, the location, to where they can come and bring their used needles, get fresh ones. I think it goes a long way into preventing bloodborne diseases.
There you go. Have a good one.
The overdose rate has decreased here locally. That emphasizes the fact that this program works. My favorite part of working in Corazón is being able to employ people with lived experience.
They helped me out when I was using and drinking. They've been a real big part of my life. This is the first time I've wanted to get sober.
I was an alcoholic my whole life. Lost my place, was homeless for 3.5 years, spent some time in jail. I came over to Corazón after only about 3 or 4 months of doing volunteer work. They told me there was a position open and they'd love for me to apply. I did so, and they pulled me aside and they were like, well, there were other candidates, but I decided to go with you.
There is definitely a stigma around our unhoused population. You know, many folks who think that we chose this life, but we get to be that example that we do recover.
One of the stigmas, one of the barriers that they have is that they're already seen in a different light. They're users, they're junkies, and nobody wants to help them, that they don't feel like they're anybody. But when they come to us, we reassure them they are somebody, that their life is important, you know. So knowing that we were able to help somebody with all the resources that we offered and that they actually use them, that's a big success for me.
There's still hope for individuals like us with mental health and substance use.
The place has been a miracle to a lot of people.
Living my best life right now.